Hey everyone, my name is Alison Taylor and I'm the owner of Hand Therapy Education. I am here to talk about distal radius fractures and hopefully give you a few ideas of what to do between leaving the doctor's office and getting to the therapy office. So sometimes you miss some of the information, it's a bit traumatic, so you don't know, what to do, what did they say. So here are the top 5 things that I would say that you need to do until you get to therapy, and this will help you have a better outcome in the long term. So, number 1 is to get rid of the swelling. So the way to do that is to elevate your hand and put it above your heart. But you don't want to walk around with your hand on your heart, or you don't want to keep your arm clamped to your side or in a sling. What you really want to do is just kind of keep it up, put it down, keep it up, but when it's up there, kind of pump the swelling out of there. That's super important, okay? Number 2 is to keep moving. So you want to always keep everything that's not covered by the cast or the splint or the brace moving. That's really important because you want to keep those fingers moving in all different ways. You want to move that thumb because it should be free, and you want to try and touch as much as you can. When you do your motions, make them big as you can be, and spread the fingers wide. Now the cast is sometimes a little restrictive, so if you can, slide your other fingertips in between and work on that. That will help the alignment of the fingers, will help with pain, and will definitely help you pump the swelling out. So, some other things, number 3 that you want to do is you want to touch as much as you can. So if you touch it, you can push it out to help the swelling, but you could also just touch it and massage it. It's really important to apply touch to your hand. That means rub it on different textures, rub it on the cat, rub it on the dog, rub it on a towel. Anything that applies a different texture or touch will really work out great for circulation, for pain, and to get things where your brain knows what it's going to do when it gets out of there. So when the cast comes off, you want the brain to know where the hand is in space, and that happens by touching. So now you've got number 4. Number 4 is super important. We're going to talk about pain. So if you are in a cast and you're plated, or you didn't have surgery, but they still put you in a cast, remember that that cast is protecting that fracture site. So the important part is even if you move and you feel like it hurts at that location, you cannot hurt it because there's no tendons from those fingers or that thumb that insert right where the surgery was. So you can move them as much as you can. So if it feels a little sharp pain or a little bit of a stabbing pain, just work slowly through it. Take your time. You can even push your other fingers onto these fingers and see if that helps. But just take your time. But know that you're not going to pull that fracture apart. You're not going to do anything to that fracture that's going to be detrimental. And the key is your body will not let you hurt itself. So that's super important. Your body will stop you if something bad is going to happen. So don't be lifting up things. Don't be squeezing. Don't be carrying. Do everything that feels comfortable, but make sure you move. Now, the part about pain that I really want to talk about is that if you have pain that increases over the 3 to 4 to 5 weeks that you're in the cast, or your swelling increases and your fingers get really fat and the pain gets almost unlivable, that's not good. That means you need to go back and see your doctor because he needs to look at that cast and make sure it's not too tight. If it's too tight, it's going to crush those sensory nerves, it's going to crush your fingers together, you're going to get more swelling and therefore more pain. So it's very important that if your pain doesn't go down and your swelling doesn't go down, that you need to go back and see the doctor. Now, talking about the cast again, if the cast becomes too loose because your swelling goes way down, that's another time to call the doctor because we don't want to be sliding it up and down. We want it to be firm and snug and comfortable. You should always be comfortable in that cast, and if you're not, again, get in touch with the doctor. Now, the number 5 most important thing to do is stay positive, because if you're positive, you're going to have a better outcome. Because don't despair, this too shall pass, and often it's very traumatic, and you wonder what's going to happen with your job and your life and your kids and driving and all these things. But remember, you will get your life back, and it's our job as certified hand therapists to help you do that. So if you do all of those things and stay positive and come and see us, then we will help you with all the rest. So I hope that helps, and you guys have a great day.